learn how to successfully phase treatment in, so you don't necessarily have to do it all at once. There are some great resources, great mentors that can show you how to phase even some of the most complex clinical cases. I think of people like Dr. John Kois, Dr. Frank Spear, Dr. Leanne Brady. Pankey Institute, Spear Education, Kois Center, great places to learn. I remember I had the privilege of speaking with Dr. Kois one time on a program, and Dr. Kois said to the audience, with the proper materials that we have today, you can phase in virtually any case. So now, Naren, if we had a $40,000 restorative case, I'm making up numbers just to use an illustration.
Right.
We had a $40,000 case. What's going to happen if we present $40,000 to a lot of people? And let's say they have a desire. They know it doesn't hurt, but they want to correct it. And they find out the fee's $40,000.
I mean, I'm a math guy, so if I were to use the percentage, you'll get a low percentage of the people saying yes. So maybe I'm picking up a random number, 1%. Let's say.
And maybe you're, Sylvia is thinking, remodel the kitchen or do this, remodel the kitchen or do this, right? Or new BMW or do this, right? But what if we could phase that in by quadrant? What does the first phase cost then if I'm dividing it by 4, Naren?
$10,000.
Guess what? All of a sudden it went from there's no way I could do that. Wait a minute, I could do that.
Right.
Now, granted, they're going to have to go through and complete it, but they're going to be able to phase it in and phase it in a way that works for their budget. So learn clinically how to do treatment, even in the most complex cases where you can phase it. Now, there could be a very stray case, although I think Dr. Kois would say, I'm not sure, Gary, but there could be a stray case where you can't phase it in. That's possible. But Dr. Kois said virtually every case, given the long-term temporary materials that we have today, almost every case can be phased in. Then all of a sudden it becomes a $10,000 start instead of 40, which can become a whole lot more viable for patients.